Hello guys, welcome to our channel. Today we are going to discuss the microbiology part 1. In this I am going to discuss the general microbiology and also the bacteriology. So let's discuss the difference between the electron microscope and the light microscope. So the light microscope, the first thing that you have to remember is it is going to give the magnification of the 1000 times. But as the electron microscope, it is going to give the 10,000 times. Even if you can't see the very minor microorganisms also you can get to see here. Okay, and we are going to use the glutaraldehyde in the electron, whereas the buffered formalin in the light microscope. Next, the major difference between the gram positive and the gram negative is gram positive will be consisting of the thick peptidoglycan membrane, and also it is present with the thicoic acids. Okay, next, whereas the gram negative, it is going to have the thin peptidoglycan, but it will contain the lipopolysaccharides and also endotoxins. No thicoic acids will be presented. So this is the major differences that you have to take note. And next, motility and the organisms. Tumbling and the differential will be seen in the Listeria, darting in the Vibrio cholera, swarming Proteus, and slow swarming is the Clostridium, falling leaf like Giardia, corkscrew Treponema, lashing Borrelia, and twitching will be Trichomonas. Next, capsule organisms. Like the mnemonic, you can remember shine skies. What are those? Streptococcus pneumonia, Haemophilus, Neisseria meningitis, Escherichia coli, Salmonella typhi, Klebsiella pneumonia, and the Streptococcus agalactiae. Next, what is conjugation? Conjugation is transfer of the plasmid DNA from one bacterium to another bacterium via sex pilus. So you are just transforming the DNA for one bacteria to another via sex pilus. This is the conjugation. And next, transformation. Uptake of the naked free DNA fragments from the environment competent bacteria. There is no cell contact is required. Next, transduction is something we use the bacteriophage for the bacterial DNA transfer. Okay, these are the important definitions that has been asked in the previous sessions also. Next, bacterial growth. What happens in the bacterial growth? Usually in the lag phase, this is the lag phase where you are going to see only the size increase that has been seen. Next, log phase, here where you are going to check the antibiotic action, and also cell division and growth will be also seen. That's why there will be exponential growth that you are going to see. Next, stationary phase where you are going to see nutrient depletion and waste accumulation. Next, death decline, there will be decline in the new cell formation of the death rate. Next, here you can see bacterial shapes. This is the cocci, and here you can see this is the bacilli. And next, Vibrio, Spirelia, and spirochetes, spore kind of. Okay, and also the clustered cocci. All these are the types of the bacteria. Remember, the all the cocci are single or in the groups, and most of the cocci will be the positive only, except meningococci, gonococci, Moraxella, and the Billionella. Okay, most of the cocci is the gram positive only, except some of them like meningococci, gonococci, and Moraxella and the Billionella. Bacilli. The most of the bacilli will be the gram negative, but except, remember the mnemonic McDonald. What is meant by the McDonald? Mycobacterium, anthrax, Clostridium, diphtheria, nocardia, actinomyces, listeria, and diphtheroids. These are the only gram positive. These are the positive. Okay, don't forget. Remaining all are mostly gram negative only. Next, coming to the gram staining, how we are going to do the gram stain? First, we are going to add the primary stain, and then we'll add the mordant, which will make the dye to look better. And next, decolorize it, and these decolorizers will washes away the stain from the gram. And next, counter stain will add. So from that we can see clearly what is the organism. Okay, so what is the primary stain in the gram stain? That is the crystal violet. Next, step 2 mordant is the iodine, and decolorizer is the alcohol. This step is very important. Next, saffronin is the counter stain that we are going to use. Next, gram positive will look like a purple, gram negative will look in the pink color. Next, we also have the acid fast bacilli, that is the gel Nelson stain. The first primary stain we are going to use the carbonyl fusion. The fixator, instead of the mordant, we are going to use the fixator, that is a phenol, and a decolorizer will be the acid alcohol, or the H2SO4, and the counter stain will be the methylene blue that we are going to use for this patient. Bacteria classification, as we discussed, bacilli, cocci, branching. What are the examples of the bacilli? Aerobic and the anaerobic. Anaerobic type is the Clostridium. Aerobic type will be the Listeria, Bacillus, Corynebacterium. Next, branching filament aerobic Nocardia. Anaerobic will be the Actinomyces. Another important point that you have to remember, Nocardia is a weak acid fast, even though it is a gram-positive bacteria. Next, when you are classifying the cocci, mostly all are the aerobic. You have to do the catalase test. If the catalase test is positive, those are the Staphylococcus. If the catalase test is negative, those are the Streptococcus. Streptococcus, we have the alpha, beta, and gamma hemolysis. Alpha hemolysis, and then again we are going to check for the optician sensitivity. If optician sensitivity is present, then it is a Streptococcus pneumoniae. If it is not, Strep viridans. Next, beta hemolysis, B for beta and B for bacteriocin sensitivity. If bacteriocin sensitivity is positive, that is a Streptococcus pyogenes. If it is a negative, it is going to be the GBS. Next, alpha hemolysis, gamma hemolysis, sorry. This is going to be the growth in the 6.5% of the NaCl is present or not. If it is present, E. coli, sorry, Enterobacteria, cocci will be the same. Non-Enterobacteria, Streptococcus bovis, which will be seen, that is not positive in the growth in the NaCl. Next, after the catalase positive, we discuss this is the Staphylococcus. Next, Coagulase test. Coagulase is positive, that is the Staphylococcus aureus. If it is a negative, then we are going to check for the novi biosyn, and that is a Staphylococcus saprophyticus negative. This is a negative, and here it is a positive, that is a Staphylococcus epidermiditis. This is the classification that you can easily remember in the examination if it is twisted questions. Next, coming to the organisms that cause the most of the conditions we discussed. Staphylococcus epidermiditis. It is going to cause the prosthetic device diseases, IV line bacteremia, CSF shunt infections, valve surgeries, hip implants. That is going to be seen. Okay, Staphylococcus aureus. This is the common infection that we see, right? Many of the conditions, for instance, such as food poisoning, Staphylococcus scalded syndrome, toxic shock syndrome, and also skin infections like impetigo and folliculitis, furuncles, carbuncles, and deep infections like osteomyelitis, necrotizing fasciitis, septic arthritis, toxic shock syndrome, endocarditis, pneumonia, abscesses, bacteremia. All this will be seen with the Staphylococcus aureus. Another important that you have to remember, it is positive for the mannitol salt agar and blood agar yellow colonies will be seen, and best cultures will be the Ludlam's media and the milk salt agar. Okay, and coagulase positive, catalase positive that you are going to see. Next, coming to the this two important points, methicillin resistant Staphylococcus aureus. The mechanism is MECA gene mutation, whereas vancomycin resistant Staph aureus, that is seen with the VAN-A gene mutation, right? Next is streptococci. In the streptococci, the most of the common infections that are going to be the suppurative infections like pharyngitis, quinsy, acute membranous tonsillitis, and also cellulitis, erysipelas, necrotizing fasciitis, scarlet fever, streptococcus toxic syndrome, acute rheumatic fever, post-streptococcal glomerulonephritis. Here you can see this is how the quinsy, the swelling where it is pressing the uvula, and tonsillitis in the patient. Okay, these are the conditions that is associated with the streptococcus. Okay, and what is the important points? In the blood agar, you are going to see the pinpoint colonies and gram positive cocci arranged in the chains and the pairs. Next is group B streptococcus agalacticae. This is going to be the CAM positive. What is the CAM test, guys? Here you can see this is how the CAM positive will be seen. So here the organism is present and here the organism is not present. That is how we are going to differentiate the GBS syndrome, GBS condition. Next, causes are most common with the neonatal sepsis, like less than 72 hours you are going to see with this patient, transmitted from the pregnancy in the during birth, and streptococcus pneumoniae. Streptococcus pneumoniae, chocolate agar Drotman like appearance. Here you can see this is the Drotman like appearances you are going to see. And diseases are meningitis, otitis media, pneumonia is the most common cause, sinusitis, and also conjunctivitis. As I said, the most common pneumonia acquired by the condition is this only. Next, gram-negative diplococci, kidney-shaped diplococci nuclei. How we are going to see this one? The two examples, Neisseria meningitis, Neisseria gonorrhea. Neisseria meningitis will be having the capsule, whereas no capsule present in the and gonorrhea. And meningitis, M for meningitis, M for maltose. Maltose is present in the meningitis, whereas only glucose, G for glucose, G for the gonorrhea that will be presented. Meningitis common way of the transmission is the respiratory droplets, whereas the gonorrhea will be the sexual and the perinatal. And also other diseases like meningitis, meningococcemia, severe conditions. Okay, and here the all the genital infections, ocular and oral infections that is seen with the gonorrhea. And what is the agar that we are going to here use? Commonly Thayer Martin only we are going to use for the both. Okay, that's the important thing that you have to remember. And coming to the meningococcal meningitis, this is commonly seen with the children, most commonly children. Respiratory droplets is the main cause, and severe meningitis with the rash. You have to confirm this is the meningitis only. If it is progress, it is caused the Waterhouse Friderichsen syndrome. It's nothing but the bilateral adrenal hemorrhage. If it is happened, every adrenal hormone will be shut down, and there will be increased risk of shock and death. Okay. Next treatment is commonly we are going to use the ceftriaxone as the first drug of the choice. Gonorrhea patients, this is the most common urethritis and also epididymitis and prostatitis. And in the females, it will cause the cervicitis and the urethritis, pelvic inflammatory disease. If it is a complicated, we are going to use the Fitz-Hugh-Curtis syndrome also seen in this patient. Gonorrhea is seen in the neonates. This is the most common severe form. And how can we prevent? Using the erythromycin eye ointment within the 1 hour of the birth. Next, the test we can do is the NAT PCR or the gram stain culture can be done for this patient. Again, ceftriaxone is the drug of the choice for this patient. Mycobacterium tuberculosis. This is the acid-fast bacilli and aerobic non-motile type. Mycolic acids are present in the cell wall of the mycobacteria. It's an obligate arrow, and coming to the primary tuberculosis is the most common cause. It will cause the lymphadenopathy. Gone focus. Here you can see this is the gone focus, and here this is the lymphadenopathy. If the both are known as a gone complex, usually involve the mid or the lower lung zone, it is commonly used. Secondary TB, it is actually the secondary TB is due to reactivation of the TB. Okay, this will be seen in the apex. Now we discuss this is seen in the here in the lung zone, but here it is going to seen in the apex of the lung. Okay, next it may form the cavitary lesions also, which will cause the caseous necrosis. Okay, non-caseous sarcoidosis, but the caseous necrosis is the TB, highly contagious, and there are many types of the extrapulmonary TB. Okay, it can induce the meningitis and also lymphadenopathy and bone osteomyelitis, or the patient will be having the Pott's disease, urogenital tuberculosis, and also disseminated like miliary tuberculosis. The most of will be the extrapulmonary TB also is presented. Next, drug resistance if we decrease, the multi-drug resistance, isoniazid and the rifampicin, and XDR means will be the X drug will be multi-drug resistance with the another drug, that is a fluoroquinolones and the any injectable such as the amikacin. Next, total drug resistance for all the known drugs, whatever we are using, the all the drugs are already resistant in this patient. BCG vaccine is a live vaccine. Danish 1331 is a strain, and it is given at the birth ID. Okay, intradermal. Most commonly, it is for the product providing the protection from the CNS TB rather than the miliary and the other TB types. Next, Bacillus anthracis is a spore forming. Okay, Bacillus anthracis is the spore forming, and it is going to cause the two types. One is the Hyde-Potter's disease, another one is the hemorrhagic pneumonia. And cutaneous, if it is a skin condition, it will cause the issue. If it is an inhalation, it is going to cause the pneumonia. Black issue and the pneumonia characteristic of the Bacillus anthracis infection. Okay. and it is also terrorism can be used by this one. Okay, next, it has the two factors, edema factor and the lethal factor. Edema factor will increase the camp and lethal factor will cause the cell death. Okay, and features that you have to remember, it is look like a bamboo stick appearances, string of pearl appearances, and also inverted fir tree appearances, medusa head colonies, all this will be seen. Here you can see this is how the presentation will be seen. Okay, medusa head and bamboo stick appearances that you are going to see with this one. Bacillus cereus, it will be having the emetic toxin, enterotoxin. Emetic toxin will cause the vomiting, and the enterotoxin will cause the diarrhea. It is also spore forming type only, and most commonly it will cause the rice based like fried rice. Okay, these are the something that will be caused by the Bacillus cereus. Next, Clostridium species like Clostridium tetani, we all know that it is going to cause the completely the muscle contraction. Tetanus will be seen in this patient. Spastic paralysis that we are going to see. Tetanospasm that is going to inhibit the GABA and the glycine in the neuromuscular junction. Next media is used is a Robertson cooked media that we are going to use. Clostridium perfringens, we have the gas gangrene formation. Here you can see this is the gas gangrene, myonecrosis, and food poisoning will be seen in this patient. Sorry guys. And where it is going to have the alpha toxin, which is known as the lecithinase. Test that we are going to do, remember NTR, Niggler's reaction, target hemolysis, and the reverse camp test. The three are going to seen in this patient. Clostridium botulinum, this is the flaccid paralysis, complete opposite to the tetanus, and there it is a GABA and glycine, here it is a acetylcholine inhibition. Patient will be having the diplopia, dysphagia, dysarthria, dry mouth, descending paralysis, dyspnea. All these D symptoms will be seen. Even death also confirmed if it is a respiratory failure. Clostridium difficile is a pseudomembranous colitis. Here you can see this is the pseudomembranous colitis where the mostly the patient is taking the antibiotics such as clindamycin, cephalosporin, fluoroquinolones. Misuse of the antibiotics is the Clostridium difficile infection. Media is the CCFA, cycloserine, cyphaloxime, and the fructose agar that we are going to use for this patient. First line you can give the metronidazole and then you can give the vancomycin. Then fidaxomicin is the drug of the choice for this patient. Corynebacterium diphtheria. This is the metachromatic granules that you are going to see. Chinese letter appearances which will be seen. Here you can see like Chinese pattern you are going to see. Next, diphtheria is an exotoxin that will inhibit the elongation factor 2, which will further decrease the ADP ribosylation and protein synthesis is blocked. And that's why this patient will be having the mostly pharyngitis, such as gray-white pseudomembrane is seen. It will bleed upon the removal. And also lymphadenopathy, which will be known as the bull neck appearances. And the media that we are going to use a Loeffler serum, tellurite agar, and elk test that we are going to see for the toxin detection. Escherichia coli and the Escherichia coli. In that we are going to see the mostly diarrhea conditions. Okay, one is the toxicogenic. This is the most common traveler's diarrhea, and hemorrhagic. Hemorrhagic, the name itself telling it is a bloody diarrhea. And also other strain that we are having the pathogenic. It is present in the infantils, most common overall worldwide. But if it is India, it is the one which is the hemorrhagic type is the most common in our India. Toxicogenic, whenever the traveler's diarrhea that will be seen. And the other two is very not so important. What you can remember is the infective type, or this one will be the dysentery, and other type will be persistent in the children, those who are suffering from the diarrhea. The media that we are going to use the McConkey agar because this is going to differentiate between the lactose and the non-lactose fermenters. Salmonella typhi is the most common, which will be causing the typhoid fever, and the Salmonella paratyphi will be causing the paratyphoid fever. Non-Salmonella type will be the food poisoning and the gastroenteritis. And how we are going to do? First week you are going to do the blood culture. Second week agglutination and the Vidal test. Third week it is a stool culture. Fourth week it is the urine ELISA. Okay, BASU. Remember the mnemonic BASU. How we are going to proceed in the first, second, third, fourth weeks. Okay, and the enrichment media is the selenite growth that you have to remember. Shigella is going to cause the dysentery. The flexure is the most common in India. Pseudo Pseudomonas aeruginosa, like green color. Why this is having the green color, kind of the pulse, green color of the rods, green color of the discoloration, green color nail syndrome, all this is because of this condition. Okay, blue green pigment that is going to show the pyocyanin in the Pseudomonas aeruginosa. What are the diseases that is associated? Shanghai fever, burns, UTI, pneumonia, malignant otitis externa, sepsis in the immunocompromised patients, ventilator pneumonia and the osteomyelitis. Cetrimide agar, it is only present for the Pseudomonas aeruginosa. Vibrio cholera. Vibrio cholera has the three serotypes. One is the Inaba Ogawa Hikosina. It is mostly seen in the Japan strains. And in our India, that is the Bengal strain, most commonly in the southeastern areas. Like there is going to have the bee bites. What it is going to do? It is going to adhere to our intestine. How? With the help of this GM1, ganglioside 1, that is going to attach and it is going to enter into our cells and cause the diarrhea. Okay, and other things that you have to remember about the cholera is the it is going to show the positive string test, and also it is going to show the alkaline peptone water enrichment, and best sensitivity is the TCBS that we are going to use for this patient. And other species, Vibrio parahemolyticus, it is going to show the Kanagawa phenomena and the Vogat agar, and seafood related gastroenteritis seen with the Vibrio parahemolyticus. Next, Haemophilus ducreyi, it is going to show the school of fish or the railroad truck appearances, and it is going to cause the chancroid. You all know chancroid will be seen with the Haemophilus ducreyi, lymphadenopathy. Both are painful only. Okay. Next, coming to the Haemophilus influenza, it have the two things. One is the humin and the NAD factors for the growth, and this is going to cause the meningitis, epiglottitis, otitis media, and the pneumonia. Chocolate agar and the satellite phenomena will be positive in the Haemophilus influenza. Haemophilus aegyptus, this is going to cause the acute purulent conjunctivitis in the eye. And other like Haemophilus organisms, that is going to cause the culture negative endocarditis. What are the organisms? HASC. Okay, HASC type is going to cause Haemophilus species, Agrigobacter, Cardiobacterium hominis, Echinella cordens, Kinganella kingae. Those are the organisms cause the culture negative endocarditis. And the chlamydia can cause the trichoma, right? Three species. One is the A to C which will be causing the trichoma, D2K causing the STD, L2L3 that is going to cause the LGV. Okay, trichomonas has three species: A to C trichoma, D2K STD, L23 is the LGV that we are going to see. The best test that we can do is the NAT test that we are going to proceed. Mycoplasma pneumoniae. It is does not have the cell wall and it is going to cause the atypical pneumonia, most commonly known as the walking pneumonia. And on the specially on the Eton's agar or the PPLO agar, it is going to show the fried egg colonies, like this fried egg colonies that you are going to see. Next, last one, that is the Rickettsia species. Rocky Mountain fever is caused by the Rickettsia by the tick. It is the most common rickettsial disease in the US. Epidemic typhus is caused by the Prowazaki. This is due to the louse and associated with the poor hygiene. Endemic typhus is due to the typhi. It is due to flea. And scrub typhus is Orentia sugamushi. This is due to the mite. Ishar is on the bite side, you are going to see. Rickettsial poxy, this is due to Akari and also mite and Ishar and the vesicles is seen. Q fever, it is a Coxiella burnetii. No vector is present. Pneumonia and the hepatitis will be seen. Trench fever, Botaniella quintana, this is due to louse. Bone is commonly affected, and relapsing fever that you are going to see. So I want you guys, while reading, keep the resource of that you are using and take note of all these important points. Okay, so those who are new to this channel, please do subscribe to this channel, and soon we are going to start the May ending. We are going to start the 200 plus rapid revision program. Along with that, we also going to release the Triple R book with the many other books like image based book and 100 one liners, and also all the drug of the choice and sure shot series book. So these four books along with the triple R we are going to release. Okay, so stay tuned for the more updates, and those who are new to this channel, again please do subscribe and share with your friends. Until then, see you guys and happy preparation.